this next unit is, we talked about legal and ethical issues, and so this first little section that we're going to talk about is clients' rights, patient rights, basically. And you can usually go to, and we'll look actually at Hunt Regional's website on Monday, or Tuesday, I guess, and then we'll look up and what their patient rights are. They're pretty much the same anywhere you go, typically. It's kind of like, our rights as a citizen. Patients have rights to their health care, to make their own decisions, to see their medical records and so forth. So that's kind of what we'll be talking about here. We will get in, Tuesday we'll get in and talk about advanced directives, which we probably talked about a little bit last year, but didn't go into great detail. And then we'll talk about informed consent, and we'll go into the syphilis study at Tuskegee. That has some reading with it, about 30 or 40 pages out of a book. So, this book that Miss Falls gave me. She wrote it. She actually met the guy who wrote it when she was in D.C. a couple of years ago, and anyways, brought me the book. So,
Miss Falls has led an interesting life.
It's true. Okay, so clients' rights and choices. Let's look at this this situation here. It says, where it says engage, it says a 54-year-old woman with diabetes and schizophrenia has been hospitalized with unstable angina. Do you know what angina is?
No.
Chest pain, chest pain, bilateral heel ulcers, urinary retention caused by an acute urinary tract infection, and anemia caused by a combination of gastritis, which is what? Inflammation of the stomach, and chronic renal failure, which is what? Kidney failure. So she's got a lot going on. Obviously, if she's got heel ulcers, well, it's diabetic. So anyways, it says 1 year ago she was hospitalized with diabetic ketoacidosis. Talked about that before a little bit. Maybe that was anatomy though. Where your blood pH level gets more acidic than it should because of the amount of sugar.
Mm-hmm. Yeah.
So it's called DKA is the acronym for that. But anyways, after reporting that, voices told her to stop taking her insulin. Currently, she is improving but requires a urinary catheter and must keep her legs elevated at rest. She says she is now able to take care of herself and wants to return home. Does this patient have the capacity to make this decision?
If she has voices in her head, then she's pretty kind of got right mind.
Okay.
Because then the voices are going to tell her just like...
Yeah.
Well, it says she's improving about that, but I wouldn't let her go home because she has to keep her legs elevated.
I think they should have someone go to her house if she did go home.
Yeah.
Hey,
Yeah, make sure she's taking her medicine.
that's the new
That's
thing,
what
right? Because if
the
she
voices are going to tell her again to stop taking your medicine.
Right. And that's what you have to, this is where things like this get sticky. When is someone, how do you really determine if someone is in their right mind enough that they can take, make decisions on their own? When do you, it gets really kind of hairy looking at situations like that.
But if she's telling you, the voices told me, and you're just like, what are you talking about?
Does she have a tumor? Like, I know some tumors.
She's schizophrenic.
Oh.
And schizophrenic,
They have that
couple
too?
things that can happen with schizophrenia. One, they can have hallucinations, which is like the voice is considered a hallucination. They can see things, see people. I had a patient one time who didn't have schizophrenia. It was another type of, it was actually it was a brain disease, but it wasn't like actually a mental illness. It caused it, but you would see bugs crawling on the wall all the time. Just like covering the walls. Which would be miserable. Yeah, that would be miserable to see that all the time. So anyways, but that's a hallucination, just seeing something like that. They can also have delusions. And a delusion is more like there's all kinds of different delusions, but delusion is more of actually thinking something different. Like maybe they think that, they're Michael Jackson or Elvis or something,
Or
but
the
they actually
aliens are coming
believe
to
that.
get 'em.
Do what?
Or the aliens are gonna come get them.
Right, that's more like a delusion. The paranoid, that would be more like a paranoid delusion. Make sense? So schizophrenics typically, they're not on their medication, especially, those are things, that's pretty typical schizophrenia symptoms.
If you have schizophrenia, like, wouldn't you automatically not be you at learn?
Well, not necessarily. I mean, if somebody's taking their medicine like they're supposed to and their medicine is effective, they can still function, you know. I mean, they're gonna need counseling, they're gonna need frequent doctor visits and so forth, but there are medicines that can, you know, repress all of that, but
So if she went home, she could just be like on home health.
she could, potentially. So, but the thing is, you know, voices told her to stop taking her insulin, so obviously her schizophrenia has, you know, is not just really well taken care of. So in my mind, it's probably a better option to send her to a rehab or something like that for a while so she can be completely stabilized. But that really is the question. At what point do you determine that someone can make their own decisions? You know, and that becomes a very ethical dilemma because everybody has a right to their own body, but at the same time, when is it okay to take away that right, you know?
So what would you do? Like, would you?
It would
ask the
just
doctor?
depend on how consistent she was, and, you know, I definitely want a psych evaluation done and things like that, but I don't know, it depends on more of the situation. So let's look, client autonomy, what is auto, do you remember?
So,
Self. It says, this is the right of patients to make decisions about their medical care without their healthcare provider trying to influence that decision. So basically, client autonomy is just the client or the patient's right to make decisions for themselves. It's their right to their own body. And we all want that, right? That's something we all expect. If I go to the hospital, I don't care who you are, like, in the end, I'm the one that's gonna make the decision, you know, or my family or whoever I designate. Says patient autonomy does allow for healthcare providers to educate the patient, but does not allow for them to make the decision for them. And that becomes really important. It's always something in my initial paperwork. If I was going to see a home health patient, I would say, you know, we can't make decisions for you, your physician can't make decisions for you, you have to make decisions yourself. But we'll give you all the information you need to make an educated decision. And that's the key in healthcare, that's why we have to be really careful that we don't give opinion, or we don't just give advice as to what we think, that we always stay objective. Because, you know, you want them to make the decision on their own. It's kind of like when I had Hannah, I labored all day and just wasn't moving, and so finally about, I don't know, probably 10 o'clock that night, the doctor was like, you know, you can either just wait for a while longer, and then you can keep trying, or, you know, we can do the C-section. And so, you know, I already knew I knew what a C-section is, and I already know risks and everything involved, but, you know, I said, well, what do you, and I just asked her. I mean, she didn't tell me what she thought. She didn't say, you know, she was like, we can keep trying, or you can go with the C-section. And I just said, well, what, you know, I mean, honestly, what do you think? Am I still going to have it even if we wait 2 hours and try again? And she said, at this point, probably. But, you know, there's no way to know. Well, whatever you want to do is fine. And so we just opted to go ahead and have the C-section. But she didn't tell me that, you know, she wasn't like, oh, I think that this is going to happen. She was willing, there wasn't any danger at that point, so they were willing to, you know, keep trying. So that's I don't know, it's one instance where I asked specifically, what do you think? And she still didn't give me like you know, she still wasn't going to tell me what to do. She still just told me, you know, this is what could happen, this is what could happen, but it's up to you to make up your mind. So, I don't know. Kind of a real life thought, but. So sometimes the right to autonomy can be overridden in the interest of protecting others who may be harmed by the patient's decisions. So that's typically when you'll see somebody lose their right to their self if they're still conscious. Now, if somebody's unconscious, obviously they can't make their own decisions. If someone who's conscious, if they've threatened either to harm themselves or harm someone else, their autonomy is gone. That decision will be made for them by the healthcare personnel or court. A lot of it's court ordered at that point. They have to go. You see a lot of people who go into like a mental health facility, they're court ordered to go there. The physician says they can't leave here, they're not safe, either to themselves or someone else, and so they get put into a mental institution or a mental health facility, whether they want to go or not. But that's how they determine that, is if there's a risk for harm involved. Does that make sense? Everybody understand client autonomy? It's their right to themselves to make their own decisions. Okay, it says informed consent. This is the healthcare provider must advise a patient about the potential benefits, risks, and alternatives involved in any procedure or treatment. And we'll get more detailed into this in the next couple weeks, but this just means that they have been informed of what can happen, and this is usually done for a procedure like some kind of any kind of surgical procedure, inpatient or outpatient, all kinds of procedures, whatever. But informed consent just means they've been informed of everything that can possibly happen, everything that's expected to happen, and then they consent to do that. And you'll see if you've ever been to the doctor, if you ever had to go by yourself, you probably had forms to sign, like an informed consent. And I can't remember right now what the minor age is. I think you have to be 17 to sign your own, but I'm not sure. I'm sure you do, or like donating blood, you wouldn't be able to do that. You would need your parents' approval. Anyways. It says a critical aspect of patient rights as well as for the protection of the healthcare provider is involved in this informed consent. Patients have the right to refuse any procedure and medication, even if others consider it in their best interest to receive the care. So people can always refuse, and they will. I've had many patients say, "I'm not taking that." And so I explain again, this is your blood pressure. It's been this for the last 3 weeks. You're taking this, the doctor wants you to take this medicine because this is what your blood pressure has been, and this should bring your blood pressure down. If you don't take it, your blood pressure can get higher, and then you run a risk of a stroke or a heart attack or a blood clot. It's just, if you do take it, there are some risks involved, but you have less risk for a stroke or heart attack or whatever. It says respecting this right of the patient is a very important aspect of medical ethics. Requiring written, informed consent offers evidence in a court of law that defends the actions of the doctors or nurses involved. So you give somebody an informed consent form that says, these are the risks. I remember when my dad went in for his pituitary gland surgery, one of the major risks was a stroke, obviously, because it was, it technically is a brain surgery, because pituitary is part of the brain, or it hangs right off of the brain. And so, that was a big risk, and that was something they had to make him aware of. So, there's certain things that have to be a part of that. People need to know what they're getting themselves into, but they also need to know if they don't do that procedure, what can happen then too. So we'll talk about specifics, like I said, over the next couple weeks. Okay, end of life. It says healthcare providers need to understand the patient's wishes in order to provide the desired level of care during life-threatening and end-of-life illnesses. So, Emily, what did you see? You looked at the patient's chart. What was the very first thing you opened up to?
Full code.
It said full code. Okay, that means something happens to that particular lady, then they want CPR, life support, everything.
Yeah, she showed me. When I was in there with Julie, she was showing me the chart and showing me the papers.
Mm-hmm. Some of them you'll typically see if it says DNR. What does DNR mean?
Do not resuscitate.
Do not resuscitate. and it'll be a big red paper in there. And that means if they quit breathing, then they don't want them to do CPR or put them on life support. Most patients at the nursing home, I would say you'll see are DNR, unless they don't have family or they didn't draw up those papers ahead of time.
Yeah, she said that it's a few patients up there that they like what is it? ADS? I think? No.
APS,
Yeah.
Adult Protective Services.
Yeah, she said it was a few people up there, like, they have a person that deals with that,
Mhm.
and she's like their guardian, and she said that all of those people, they have to be full code. She
Yes.
says they can't be DNR.
And that's just because they don't have family or somebody that knows them to take, they don't know what her wishes would have been, and so they're going to err on the side of keeping someone alive, So, but, like I said, typically the ones that have family members, or if they had already made their wishes known beforehand in writing, they'll be a DNR, a do not resuscitate. But yeah, they can't do that for people who, are taken care of by the court, basically. They're not going to make that decision. Says this can be controversial in a situation where a healthcare professional has performed procedures or life-extending care when the patient has made it clear that only minimal or comfort measures of care are desired. Big time ethical issue. And so it's always important anywhere, if you guys ever work somewhere that hopefully you all work somewhere, but if you ever work in healthcare, it's always important to have an idea of if your patient is a DNR or not, because you don't want to do CPR on them if they don't want it done. Because, what if you do CPR? Well, at that point, you can't just stop it once you get started. And, what if they stay alive on life support for a year? You know what I mean? There's no quality of life there, especially if that's not what they wanted. So, advanced directives, and we'll talk more about this Tuesday, but a legal document that a patient signs defining the type of health treatment and care they would like to receive in situations that arise, like if they're not able to make decisions for themselves. So there's basically 3 types of advanced directives. You can actually do like an advanced directives where you state what kind of maybe I specified, maybe I said that wrong. There's 3 types. You have a living will, medical power of attorney, and my mind just went blank. Oh my gosh, my mind went blank. Maybe it's durable power of attorney. Anyway, a living will is just a paper that you fill out yourself and you specify what kind of treatments you want. Like if you get to a place where you can no longer take care of yourself and you can no longer make decisions for yourself, what are specifics that you want? Like some people might write down, yes, I want, like, I do want you to feed me. Maybe they do want, like a feeding tube or something, but they don't want to be put on a respirator, or they don't want you to just keep them alive on life support. They can specify that on a living will. Make sense? So, like, I can make a living will that says, if I'm ever in an accident that renders me, can't make decisions for myself, I do not want to be left on life support. It's a living will. But you can specify specific, you can be as specific as you want to. Another one is a medical power of attorney, and that means that you designate a specific person to make those decisions for you. So I can say, in the event that I'm unable to make decisions for myself, I designate my husband to make those decisions for me or whatever. So that is a medical power of attorney, and that person is called your healthcare proxy. Anyways, a durable power of attorney is both, like, they can make health care decisions for you, but they can also make, like, business decisions and other like life, decisions too. A DNR is another example of an advanced directive. Maybe that was the third one I was thinking of, just to do not resuscitate, and we'll look at those specifically. It says, without written documentation that expresses the patient's wishes, confusion can occur, leading to errors in providing or withholding care of the patient. And it can lead to ignoring a patient autonomy. Clients have the right to expect individualized, safe, competent, and beneficial care. Okay, those are everyday things that they should be able to expect. Healthcare workers are legally responsible for the care given to clients. So it says the scope of duties a healthcare worker may perform is defined by their level of training and education. We know that, right? That's your scope of practice, what you can do according to what you've learned and what education you have. It's malpractice to perform skills past the level of the healthcare worker's training and education. Malpractice. What does mal mean? Bad. It says it's malpractice to neglect to do something that's considered common practice. We talked about that last year, right? We talked about neglect something. But neglect is not necessarily that you're doing something that's wrong, but that you're not doing something that you are expected to do. Like washing your hands. Or maybe a patient had one care order and you just didn't do it when they got an infection. That would be neglect. Make sense? Errors may result from emotional, psychological, physical, and financial burdens being placed on everybody involved. Prevention of errors is always best. We already know that, right? Prevent it. Remember the ladder and the...
Oh, yeah.
Prevent it. Okay, it says ethical guidelines to be followed at work. It says health science students, that's you guys, are thought to know more about healthcare because of their work and training. People frequently ask questions about health problems and may rely on the answers given by students or anybody in healthcare, we'll say. Students must answer with great care. You always have to, and I do the same thing. Now, for me, if you come ask me a question, I'm not 100% sure of the answer, I'm going to say, no, you really need to see a doctor, or you really need to ask your doctor. That's not something that I'm comfortable answering. It says take proper care of equipment and supplies. Be accurate in following directions and reporting, treat coworkers with respect, and you want to be able to work with your coworkers as smoothly as possible. Complete assigned tasks. Everybody else's job, that's one thing with healthcare, everybody's job depends on your job. Everybody depends on each other, and when one person fails to do their job, it messes up other people along the way. And the bell may ring. Oh, no. It says, do not grant a patient's request that is not mentioned on the chart without checking with whoever needs to be checked with. Okay? It may not say, the chart may not say whatever, but maybe they're not supposed to have anything to eat, but they ask for a drink. Well, if you give them a drink, that can delay their surgery if they're supposed to, be in PO. Think about that. So you just, you always want to ask. If it's not something that's specified in your chart, always ask. And that's the same thing for you guys at the nursing home. If somebody asks you for something, you need to make sure to tell the nurse that they've asked for it. Accept no money or expensive gifts from patients. Sometimes that's hard to do, especially like home health. There were always people always doing stuff. Some of them would make jelly, some of them would. And if something like that, you're going to hurt their feelings more if you don't take it. But you get into big time legal issues if they offer you money or if they offer, some other kind of expensive item. Now, I've had patients make me like doilies before and stuff, that's not a big deal. But you don't want to do that because you're getting paid for their care already. And you run into major, major ethical, legal problems taking things from them that, aren't specified. Respect their privacy, always, always, always. know and follow the healthcare facility's rules. Don't discuss personal problems with patients. We've talked about that before. They have their own problems. They don't need to worry about theirs and yours. So they'll ask you, and you'll hear them. I mean, they'll ask you, and just give, what information you have to answer their question, and then do your best to turn the conversation back on them. What about your family? They ask you about yes, I have a child. What about you? How many kids do you have? Turn it back to them. So it's treat all patients with kindness, compassion, and respect. Help them to maintain their dignity and their confidence. People are at their lowest point usually when they're sick. They don't feel good. They're in the hospital. They're in wherever they are. And so, we want to make that as easy as possible for them. And then it says to respect their religious beliefs, and that's a given. You always want to make sure. Doesn't mean that you have to believe what they believe. It just means that you do have to respect it. Let's see. Why don't we